Hello and welcome to your daily Sex IQ question at 5MI Weekly. Today's question concerns the biology as well as the psychology of sex therapies. Before sharing today's question, let's do a quick recap on what we've learned thus far from your Sex IQ test. We've learned the average age people are first engaging in sexual intercourse, the percentage of men having extramarital affairs, the percentage of women who have engaged in anal intercourse, the probability of transferring HIV during intercourse, the hardiness of HIV, the biology of personal lubricants, how expansive sexual experiences are, the fallacies of gaydar, the relationship between menstruation and pregnancy, the effectiveness of birth control, the goings-on during gynecological examinations, the importance of testicular self-examinations, and the etiology of erectile dysfunctions. What will we be learning today? True or false? Almost all erection problems can be successfully treated. Give yourself a point if you said true. 64% of Americans got this question correct in 1991, and 66% of Americans got this question correct in 2016. What do you want first? The good news, the bad news, or the very bad news? The good news is most erectile dysfunctions are readily treatable, with treatments ranging from something as simple as introducing exercise or medication into one's life to things more complex, such as surgery for a penile implant or psychological counseling. The bad news is most men do not seek treatments for their erectile dysfunctions. Recent studies report only about 25% of men do so. Maren Gott and Sharon Hitchliff of the University of Sheffield reported on some of the most likely barriers standing in the way of men seeking treatment for their sexual dysfunctions. They include the fear of being judged by their general practitioner, assuming sexual problems are due to the normal aging process, a lack of knowledge about potential treatments, perceiving sexual problems as not being serious, and shame, embarrassment, and fear about sex and sexuality in general. The very bad news is most treatments for erectile dysfunction do not address the psychological or sociocultural roots of the problem, instead focusing exclusively on the physiological roots. For example, Drogo Montague and his colleagues at the American Urological Association make this point perfectly clear when they share the American Urological Association's treatment options for erectile dysfunction. The currently available therapies that should be considered for the treatment of erectile dysfunction include the following: oral phosphodiesterase type 5 inhibitors, intraurethral elprostadil, intracavernous vasoactive drug injection, vacuum constriction devices, and penile prosthesis implantation. You'll note the American Urological Association does not make a single recommendation for counseling or psychosexual education within any of the recommended therapies for erectile dysfunction. So what's this all mean? Although erectile dysfunctions can be successfully treated, one should be wary of treatments that focus solely on eradicating symptoms with biological fixes, because these fixes ignore the fundamental issues of sexual dysfunctions, which are grounded in psychological, relational, and social contexts. For example, imagine a young man seeking treatment for erectile dysfunction. He's most likely to be prescribed an oral medication by his general practitioner to alleviate the symptoms. The next time he's sexually intimate, the the medication solves his erectile dysfunction. However, the fact that he does not desire his partner due to his internet porn addiction is completely overlooked. That's all my time for today. Be sure to keep a running total of the number of questions you've answered correctly and the type of question you've answered correctly as well. Today's question was both a biological as well as a psychological type of question. See you tomorrow for Sex IQ question number 15, a biological as well as a psychological question about menopause.